So choosing a surgeon is really difficult. It's surprised me over the years to realise that trusting the GP's choice is not always the best. I'm quite surprised about referral patterns from certain GPs. Of course, many GPs get it right, but others, I'm often surprised who they would choose to send a patient to for soft tissue knee surgery and indeed the more complex revision surgery, which is much more demanding. And I think it's really hard for a patient who doesn't have any medical contacts to find out. If they do have medical contacts, then doctors can ask around and usually come to the right conclusion. But I would say as a principle, it's best to choose a super specialist knee surgeon. In other words, somebody who does nothing but knee surgery. In the UK, that might mean they also do joint replacement. But there are a few surgeons who simply do soft tissue knee surgery. Also, the surgeon should be able to provide data on their practice. And now it seems shocking, but many surgeons don't keep records of numbers, etc. But I think they should, and they should have no fear about giving patients that information. The patient should have no fear in asking. If a surgeon takes offence to that question, then probably it's best not to see that surgeon, I would suggest. In terms of raw numbers, it's very difficult to give a number of minimum cases that give that expertise, because there are some surgeons who have a huge experience, perhaps have cut down on the numbers and will get it right first time, even if they did only 20 a year. But around 100 is perhaps not a bad idea for one operation. And I think if you have a surgeon doing 100 plus cruciate ligaments a year, they're going to be competent and they should be able to redo surgery. And so I think it's really hard, but I would say if you've got any medical contacts, get them to make inquiries, but also choose a surgeon who has high volume soft tissue knee. I would not go to a generalist. If somebody also offers shoulder surgery, ankle surgery, hip surgery, guess what? They're jack of all trades, perhaps they're master of none. There are exceptions, I accept, but generally the super specialist is the way to go. And that's about as good as it gets.